There are long-term factors to consider as well. A UK epidemiologist has predicted about 500,000 Brits could get so-called long COVID just from this latest outbreak. And as more information comes to light about this condition, medical professionals are warning governments need to better prepare and resource it. The Durham's Stephanie Bolchi has this story.
It's a really nasty, nasty virus that attacks your body from your head to your toes.
Rebecca Logan was an emergency nurse in Northern Ireland, taking COVID swabs when she caught the virus in April last year.
As time went on and I tried to continue to get back to my normal life, I realised my body wasn't letting me.
Prior to COVID, the then 39-year-old instructed fitness classes. Now she can barely walk.
My arms and legs don't really work that well. I can't walk for any distance. I use a stick, but then when I use the stick, my arms and upper body get exhausted.
A recent study by the University of Liverpool found nearly half of 73,000 ICU COVID patients had further medical complications, such as heart attacks and seizures, even among the young patients.
The debilitating condition that I'm in now, I'm concerned that that will be me.
Nearly 4,000 long COVID sufferers across 56 countries suffered 200 different symptoms, affecting 10 organ systems. That's according to the University College London. The majority of those took 35 weeks to recover and most commonly experienced fatigue, worsening after exercise, as well as brain fog. These are symptoms Callum O'Dwyer knows well.
It's like sort of inheriting the brain of an old man.
Callum first noticed he had COVID the day the UK went into lockdown in 2020. That was nearly 16 months ago. Since then, he's run the full gamut of symptoms.
The main one is extreme fatigue, which leads me to even small tasks like having a shower can mean that for the 20 minutes I'm in a shower, I might have to rest about an hour to 2 hours afterwards. I can't really travel more than an hour because if I sit up in a car or a train for 2 hours, then it kind of I have to have two days afterwards where I'm just lying in bed all day.
The UK has announced specialist clinics, as well as extra funding for research. But sufferers warn with no treatments in sight, this will plague health systems across the globe.
In some ways, it's completely wrecked the aspects of my life that I kind of would consider to be the most, productive or most, interesting parts of my life. And I don't want that to happen to anybody else.
Dr. Scully, this is really deeply disturbing, these results, and we still don't have enough data. Obviously, this is just starting to come in. But what do you think the long-term impacts on, British society, British economy of long-term COVID might be?
Very substantial. The data is coming in about the incidence of long COVID. And about the last data was published a couple of weeks ago, 700,000 people in the month of June reported having long COVID symptoms, 700,000 at that time. And 20,000 of those were children and young people. So it is really very serious. The government doesn't talk very much about it. They have been putting money into the research programs, that's for sure. And they have been putting money into a network of clinics across the country to try and help people. But we don't actually know what to do really about much of these symptoms that can help. Actually, sometimes vaccination has actually helped people with long COVID, for example. But I have a more fundamental concern is you've heard in those very moving accounts the effect that the virus has. And it does really remind me of my early public health training about the aftermath of the pandemic flu, the Spanish flu at the beginning of the 20th century, and in the United States, the epidemic there was of Parkinson's disease in the years later. Now, we know this virus really does affect the brain, as those reports showed. And that is why I'm so against the infection being allowed to run wild in the childhood population, because their brains are very vulnerable and they are developing. And we don't know what this virus might lay in trail for us, in store for us in the future. We shouldn't be allowing children to get this virus, or anyone.